way ahead of you.
Call Brad to get your adventure started today at Ocala Aviation, 861-7484.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. One of the interesting things about this thing we call life is that so much of it is connected, and you just don't think of it that way. You don't realize sometimes. Like we spoke to this eye doctor one time, and he said that he can tell from your eyes that you may have a problem with diabetes and other conditions. And when last time we spoke to Dr. Asandra from NuMale Medical Center, I mean we giggle about our sexual functions, etc. But if you're having trouble there, and it might not be just there. It might be a whole body thing. So we're going to learn some more about it right now. Dr. Christopher Asandra is on the phone. He is a doctor at NuMale Medical. I'm sure you've heard the advertisements for it. And it goes beyond erectile dysfunction. It goes beyond that. It has to do with, well, almost everybody will say it has to do with aging, but not always. Sometimes young guys have problems with this, right? Mm-hmm. And sometimes old guys don't have problems, or they have the problem fixed. It's not exactly, the same for everybody. And then the one thing that captures so many people's attention is when somebody says that there's actually a way to either slow down aging or even reverse aging, which would be a miracle, I think. It's why we're here. We came to Florida to look for that fountain of youth, remember?
Yes, exactly.
Dr. Christopher Asandra, good morning, doctor. How are you?
Good morning, guys. How are you doing?
Good. Where are you? Where are you calling from?
I'm actually in the Villages today, working the clinic here and seeing patients.
Oh my goodness! One of these days you got to do the show here in the studio. We got to meet you.
I should have just come down.
Well, thank you for being on the air. In my intro, I was implying that I knew something about this, which obviously, if I do, I learned it from you. But did I learn it right? I mean, if you are having erectile dysfunction, is it maybe a symptom rather than the problem itself, or does it depend?
It really depends, and kind of like you alluded to earlier, Larry, is that a lot of people say the eyes are the window to the body, and when you're having problems with your vision or something else is going on, and you may have diabetes, kind of like you were referring to, or something else is happening. Now, the same thing when you're not functioning down there as well. The same vessels that go to your heart and to your lungs, everywhere else, are kind of the same vessels that happen down there. So when we start losing function down below, it's usually a sign that maybe you're not as healthy as you were. Maybe something else is going on in the body. You may have diabetes, you may have heart disease, or something else is just not right. And that's one of the first signs that patients come to me for, and they say, something happened about a year ago. It's just not functioning right. And it's really important to kind of delve into that and say,
oh, really?
What happened a year ago that so many things stopped working? And they may have been diagnosed with diabetes, or they may not even know they have diabetes. So a lot of times when they come in, men don't want to go in because we're stoic. We don't want to go in and say, we're getting out of shape, we're gaining weight, or maybe having some chest pain or not feeling right. But they'll come in when things stop working down there and to us, and it's our job to kind of figure out what's going on, if there's an underlying cause or an issue that may be affecting this.
Yeah, well, it's kind of one of the things we live for. Do you know what I used to think, though, when I was younger, when I would hear about pills that could help you with like Viagra and I don't even know all the names, but I'm probably even pronouncing it as Viagra, right? With long I. But I used to think this, and please forgive me if I sound silly by thinking this, but I thought, well, maybe we're supposed to lose interest in sex because at that age you're not going to be able to raise children, so maybe biologically you're supposed to be weaned away from, because as children you had no interest in it, right? All of a sudden, what was Dr. Ruth would always say, when you're sexualized, then you stay sexualized until it starts to wane. And I would think, okay, well, it starts to wane, maybe at a different time for women than men, but now I'm starting to think maybe that's not true. Maybe, if you can get it to work, get it to work.
Right.
Absolutely. Yeah, absolutely. I think the biggest misconception is that we're just supposed to accept that we're aging and accept that we're losing function. And I think that's a huge misconception. A lot of doctors will actually tell their patients, well, guess what? You're this age, live with it and accept it. I believe the opposite. I think as we go into our golden years and as we age, intimacy is an important part of every relationship. It's also important to our health, to our well-being. And it's kind of shunned upon when people look at it as a dirty thing, but in reality, it's a function of our health.
It's absolutely.
Yeah, I think people need to realize that.
I got a story to tell you about a man who I knew. He lived in an assisted living facility. I worked there. Okay. And this guy, let me tell you, was hot with the ladies. He was he had to be 90. He had to be 90. I remember I drove him to the car dealership. He said, just leave me here. I'm going to drive back. I'm going to buy a new convertible. He bought a convertible. He drove back. I am telling you, the ladies in that facility were all, I would be the guy who called bingo for the ladies. And I could hear them talking about this guy. Like they all wanted him.
Herb.
Yeah, Herb was his name.
Yeah.
Gosh, you said his name. Wow.
Well, I'm a woman.
He has passed away. Okay.
I know.
Well, when he passed away, let me just tell you this. When he passed away, I watched the nurses with all of his medications, and because they have to take inventory of all the medications and then destroy them. And I saw all the blue pills, and I joked, and I said, gosh, no wonder Herb was so popular with the ladies. Mm-hmm. And I thought, I was just trying to be silly and get a laugh, but the truth is, that's why Herb was so happy.
Yeah,
so
I think it's a huge impact on your mental function. It keeps us young. It keeps us vibrant. And a reason to live every day. And unfortunately, a lot of times these pills don't work in a lot of people.
That's what I wanted to ask.
Yeah, they don't work as effective. And if you think about it, Viagra and all that, they were originally developed as a heart medication, and a side effect of it was some guys got erections from it. But it was not developed that way. I think people need to understand there's actually medication out there specifically designed for erections to help it improve and help you regain function. A lot of people get really nasty side effects too with the pills, or they can't take it because a lot of times they're on other blood pressure medications that may interfere with it. So the goal is to find a solution for these guys and get them functioning again without having to take a pill every time. But you're right. You're absolutely right. I think he was popular with the ladies. He probably died happy. And,
yes,
I would say so.
That's the way to live.
Yeah.
Right. That's the way to live.
And there was at least one lady who died happy because she had a new convertible.
Yeah. When a man had been molested as a very, very young boy, and you're talking about going to the root of the problem, and then the young boy grows up and he has different kinds of relations, and then something happens. Are you able to find out that cause also?
Well, I think it's important that, a lot of times men are very shy or embarrassed to go to their regular doctor and talk about this issue. And that's why we wanted to develop a place where men could come and speak to, a male doctor and kind of reveal and feel open to talk about their past or talk about what may have contributed to their sexual dysfunction. And we want to find the root cause of that. And sometimes if we can't help them on a psychotherapy level, we refer them out to the right facility and or person to kind of coach them or guide them through or help them get better mentally. I see it as a whole function. It's not just the physical part, but it is, like you're alluding to, a mental and emotional and psychological component to this as well. So let's find the root cause, and we can get you functioning physically. But if you need further help, let's get you to the right resources to help you out with your mental function as well.
For those of you who listen to us all the time, you know that Robert and I speak to people all over the world. And so sometimes it's a little bit disappointing when you find out that a doctor who is making sense who you'd like to go see is actually calling us from Philadelphia or from Australia.
Yeah.
Dr. Asandra is in the villages. And if he can help you, it's just a short drive to the villages. And he is with NuMale Medical Center. So I want to be sure that the listeners know kind of what you do there and maybe what you don't do. So it sounds like what you don't do is simply prescribe a pill.
Correct. And, the pills are not a therapeutic benefit. You need something that's going to actually rehabilitate the penile tissue and get it functioning again. It's like any muscle in the body. If you don't use it, you lose it, and it shrinks. And you lose blood vessel, you lose blood flow. So it becomes more difficult as time progresses to get it to function again. You need something that's going to work every single time, or at least, the majority of the time, to restore blood flow down there and get it rehabilitated. That's our goal here. Now, the side effects is you're going to get an erection as well, and the many benefits that come with it, having a better intimacy, able to rekindle your love life, etc. But let's get you functioning again down there. It's very important to men and their self-esteem and their self-confidence. It's our focus.
I'm going to try it. We'll take a break right now, but I'm going to try, guys, if you're listening, I'm going to try to ask the embarrassing questions that you don't want to call in to ask. I'm I'm going to try. But if you have a question and you're not embarrassed, please call in. The number is 622-9622. You don't have to tell us your name. You can even disguise your voice. We'll be right back with Dr. Asandra.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, times of clouds and sun with a couple of thunderstorms around this afternoon and this evening. The high today 89 to 93. And partly to mostly cloudy later tonight, though 74 to 78. Clouds will limit sunshine tomorrow. Look for a couple of thunderstorms, especially in the afternoon. The high 86 to 90. And for Saturday, clouds and limited sun with a shower and thunderstorm or two around. High 83 to 87. From the Florida Weather Center, I'm meteorologist Joe Lunder.
If you're anything like I was, the thought of getting older was the last thing on your mind. But here we are. For me, it started slowly. The lack of energy, never being in the mood. And when I was, I could never perform at my best. I tried the pills and other treatments with minimal results, and all but given up on my sex life. Then I found the doctors at NuMale Medical Center. Wow, they made a new male out of me. Feel like I'm 25 again. I have renewed vigor, so much more energy, and no longer worry about my performance. NuMale treated me like my situation was one of a kind, with a custom treatment plan that really works. I feel great. They can create one for you too. It does not matter if you suffer from low testosterone, erectile dysfunction, or just want to last longer. NuMale will help you.
Call NuMale Medical Center today at 352-404-4779. 352-404-4779. That's 352-404-4779. It will change your life. 352-404-4779.
Robin, let's try a little plant trivia. Name this nursery. It's a not-for-profit, and it teaches growing and caring for plants to their students.
Oh, that's easy. Kenny's Place.
Or how about this one? It's a nursery conveniently located between Ocala and Bellevue.
Again, it's Kenny's Place.
Or how about this one? A nursery with a wide variety of just what you need or want at the most reasonable prices.
Kenny's Place, of course.
Kenny's Place at 7677 Southeast 41st Court. Give them a call at 867-1213. It's a caring place for people and plants. It's Kenny's Place. 17 minutes after 11 o'clock. Thank you for tuning in. Dr. Christopher Asandra is on the phone speaking to us from NuMale Medical Center down in the Villages. He is on the phone to answer your questions that you might have about whatever therapy might be needed if you're having erectile dysfunction. And we also want to find out some of the benefits of some of the other therapies that they provide down there that have maybe something connected or not necessarily connected with sexual function. So if you have a question, you are welcome to call. I'm going to try my best to ask the questions that you're probably embarrassed to ask. So the number is 622-9622. So doctor, let's see. If I were going to you with an erectile dysfunction problem, I guess the first thing would be to get over that hurdle of telling you about it. But I'm guessing that's easy because that's why you're there. So as soon as I show up, you know that's the problem, right?
Absolutely. It could be a whole host of things. I think first and foremost, men need to be more open about this and willing to talk about it. Because if you hold back on your function or your performance, I can't help you if you're not fully transparent with everything. So I can find the best treatment for you. And that's the first and foremost. But, we do some tests, including an ultrasound. And another important thing we do is we actually check a man's hormones levels. We check their testosterone. We check their estrogen. Right in the office, we get your results back within half an hour. And we can kind of go through that as well, because erectile function and your overall sense of well-being could also have a hormonal component as well. Just like women go through menopause as they age. We've accepted that. But what about when a man goes through menopause or andropause?
Right,
this is important, too, to look at his hormones, because as you know, hormones decline over the years, so do health problems go up. Our hormones and testosterone's highest in our 20s, but we have less health problems. But as we age, testosterone goes down and health problems increase.
All right. I will be honest with you. I have some questions in mind that I'm actually feeling the anxiety right now because I think they should be asked, but I can feel it right now. And I'm just asking for informational purposes. I can imagine if I really wanted the answers for me personally. Let's let some listeners call. I do have at least one call on the phone, so let's take that one, and then I'll try to ask the questions that I'm thinking I would ask if I was in that circumstance. See, I'm stumbling.
I know.
Good morning.
I have a question.
Good morning. You're on the air. Thank you for calling.
Yes, good morning, doctor. If a younger man has a vasectomy, would that involve a problem with his performance later in life?
I haven't really seen a problems with vasectomies unless they totally butchered you up, really causing a problem with performance. It's mostly with prostate issues. Men who go through prostate surgeries or have their prostate removed, they tend to have a lot of sexual dysfunction. Up to 80% of them have sexual dysfunction after they have their prostate. Vasectomies, not as much. A lot of guys will contribute or attribute it to that time when they had a vasectomy, but really there's been no studies that show that vasectomies are really what's contributing to sexual dysfunction.
All right, excellent. Thank you. That was a great question. All right, so are you? Here's some embarrassing questions. Do you have to touch me down there?
We do an exam down there. Of course, it's very private. You're taken into a room right away. There's no waiting room here, so immediately you're escorted to a room so you can have your own private exam room. We do have to do an exam, an ultrasound down there to check the blood flow of the actual arteries that bring blood to the penile area. So yeah, we will have to do an ultrasound on you. It really only takes about a minute or so, but we also just want to make sure everything else is okay, that you're functioning okay, that there's no anomalies or anything else that may be contributing to it. Again, the goal is to find what's going on with you and then treat it.
And do I have to show you that I have an erection in order to indicate that I'm cured? Or do I just tell you, hey, it happened, I had it last night, I think I'm done, doctor?
Not necessarily.
Okay.
We really just want to check the blood flow and examine you to see how things are going on down there. And we will give you a test dose of the medication in the office, depending on what's going to be right for you, the best treatment, and see if we can actually induce one here to see if it works on you. Because the only way to know is if we test you, and everybody gets a customized medication and therapy plan for them, because an 80-year-old guy with diabetes is going to have a different treatment than the 45-year-old guy who's maybe a little bit younger and just having some performance issues.
Is the treatment something that we'll have to do the rest of our lives, or do you fix it once and then we move on?
Not necessarily. It really depends on the extent of your problems. It's kind of like other medical problems. If you can cure your diabetes through diet and exercise and healthy living, you probably can get off your medications. What I can tell you is about a third, 35% of our guys actually will, after undergoing therapy and the treatment, they actually get off the medication and restore function to themselves again. They're able to perform again after that.
Hey, let's take another phone call. Good morning. You're on the air. Thank you for calling.
Hi, I have to call back because I have an important question. Does most medical insurances cover the exam and the medication to get you back to normal?
Most, unfortunately, sexual dysfunction, erectile dysfunction is not really recognized by a lot of insurances as a true medical problem. And it's unfortunate. We'd have a line out the door if we could get that covered by insurance. So, unfortunately, it's an elective thing that most insurance companies don't see as a big problem with men. I differ in opinion in that, but so it's usually not covered by most insurances. However, some insurances will reimburse you for parts of it, including the office visit, or maybe if you have some testosterone therapy, and we provide all that information to the patient so they can submit it to their insurance and maybe get some reimbursement back from them.
Okay.
Thank you.
Thank you.
When a man has a horrendous accident or he goes to war and something happens down there and he loses that ability that way, can you help that person?
Depending on the cause of it and the extent of it, yes, we can. A lot of guys, we treat a lot of veterans who have PTSD, and it becomes more of a psychological issue that they need to get over that hurdle and break that barrier. So we can restore function. A lot of guys who've had trauma down there, who've had surgery that have maybe nicked some nerves and blood vessels, we can restore function to that. But again, it really depends on the patient. That's why it's important they come in, they're able to speak about it, and we can do an exam to kind of focus in on what caused it, and then find the best treatment option for them.
So let me lead into the next question with kind of an unrelated story. My dog is 15 and she looks really, really old. When I was 15, I didn't look old at all. So there must be some science to how we age, and therefore there must be science that could help us reverse aging. And that sounds like you've got something.
Absolutely.
So is it about hormones? Do hormones? Go ahead, I'm sorry.
Yes, they do. Bioidentical hormone replacement therapy is what we do, okay? And then what that means is we try to find a way to replace your hormones that mimics the body's natural release of hormones. That's kind of what I was saying earlier. When we're in our 20s, our hormone levels are the highest. We feel good, we have energy, we have libido, we can think quicker, we don't have that brain fog in our 20s and 30s. As it declines over the years, we just kind of want to sit on the couch and relax, not get out there. We're not as motivated to go out. And I think that's due to a decline in your your hormones, declining your testosterone in particular. So by replacing that safely under medical supervision and replacing it in a bioidentical way, we can bring you back to those levels of when you're in your 30s. So you feel that motivation, the libido, the energy, the mental clarity comes back, and it happens as soon as 2 weeks within initiating treatment. It really changes guys' lives to see them get on this hormonal therapy and get them back to their levels, good levels, where they actually feel better. They're losing the fat, they're putting on more lean muscle, and they're getting out and going out, and they're more of a pleasure to be around their spouse, around their coworkers, around their children. It just makes a big influence because they're happier.
So is it
a lot of guys off?
Is it possible that somebody who's been listening up until this point says, "Well, I don't have that problem. I get erections all the time," and now, but they've heard this part and they say, "But I am a little bit lethargic," and so could that person come to you and basically say, "Look, I don't have the downstairs problem, but I got the get up and go problem."
Absolutely, yeah. We want to develop a center that men could come to for that problem or for their hormonal issues and everything else. And it's something that a lot of guys will ask them. They say, "Well, I feel great. I have lots of energy," and I say, "Really? Is it like you were when you were 21?
Yeah, right.
Right? And then they're like, "No, it's not." Okay, because we've kind of accepted it and gotten used to it as our hormones decline over the years, little by little, and we just become adapted to it. But if I told you I can make you feel like you're 25 or 30 again, then they start, their ears perk up and their eyes open.
Really?
Okay, that's how I want to feel. Absolutely.
Does it help to lose weight too if you've gained weight as you aged, or is that separate?
It does. Here's how it does. If you're on hormonal therapy, you're more active, you're more motivated, you're going to want to go to the gym, you're going to get out more, but it also helps you increase your lean muscle mass. And by increasing lean muscle mass, the more muscle you have, the more fat you can burn, and it's easier to lose that weight. So it's important that everybody that comes in, we put on hormonal therapy. We say, guess what? You also need to go out now and start exercising again, because you'll have that motivation. You can't just sit at home and eat potato chips on the couch.
Yeah, right.
It's not going to work.
Right.
But you're going to lose weight faster than the guy who doesn't have his hormones balanced, who doesn't have optimal testosterone levels. So yeah, it does help with that as well.
So nutrition really does play an important role in this area also.
Absolutely. And it's important that you eat not, saturated fat. Don't eat as many saturated fats, processed foods. That can lower your testosterone naturally. Eating those organic and eating the vegetables and everything else that you should be eating, fruits, nuts, things that are essential to our health. It's important that you get on a strict diet regimen as well, so you feel good overall. And that influences the body. It helps your testosterone, it helps your erectile function, helps you feel better. So avoiding the fast food all the time and going out, it's probably the best method to really regain your function and overall health.
The best way to end this is to give information so people can come see you. And again, just let me remind the listeners that Dr. Asandra is not in Philadelphia. He's not in Australia. He's here. He's in the villages.
Yes.
So if you can benefit from the services that Dr. Asandra has been talking about, go to NuMale Medical Center. They are at, let's see if I have it right, 8640 East County Road 466, correct?
Correct.
Is
that Suite A?
Oh, it's Suite
A. A big sign out there.
Okay, and what is the phone number down there?
I think we were mentioning it earlier. It depends. I'm not sure of the phone number here. We have several different phone numbers for it. But I think the best way to find out for it is to go to our website, and that's NuMale.com. It's N as in Nancy, U as in umbrella, MALE.com. Again, NuMale.com. And then you can just give us a call at the number that we have listed there, and we can get you in to see probably almost right away.
Okay, all right. NuMale, N-E-U. Remember, it's not N-E-W, it's N-U. NuMale, NuMale.com.
You feel like an NEW male, though, once you go see Dr.
You
Asandra.
Oh, I like that.
You will.
Absolutely.
That's like a way to...
Absolutely.
And real quick, I know we've got like about a minute and a half, but we had a guest one time, and he had 20 years or something without an erection. Remember, he told us this? And that I don't remember what the book was about, but I asked him, came right out. I said, "Can you have an orgasm?" And he said, "Yeah." So I didn't know that.
Yeah.
You can actually have that, but what does it do for her? She's got to have something too.
Right. Again, it affects everybody. It really does.
Well, Doctor, thank you for being on the air with us and for helping us understand. This is a hugely, I don't know if embarrassing is the word, but anybody who's going through this really probably is very reluctant to tell anybody about it. So I understand if you didn't call, why you didn't call. I appreciate the calls we did get, but don't let it. I mean, you got your life to live. You know,
Yes.
You could improve it so much. I think it's a wonderful thing that we're able to have this relationship with Dr. Asandra and NuMale Medical Center. Thank you, Doctor.
Thank you for having me, guys.
Good stuff. We'll take a little break. We'll be right back.